Welcome to the Age Gracefully Show with Dr. Michael Grossman, the well-known anti-aging stem cell and regenerative medicine specialist, best-selling author, and founder of the OC Wellness Clinic in Irvine, California. Each week, he shares the latest information to help you look and feel your best so you age gracefully. And here's your host, Dr. Michael Grossman.
Hi, I'm Dr. Michael Grossman. Welcome to Aging Gracefully, where we talk about different ways to maintain youthfulness and vitality. My main activity of the day is being an anti-aging physician, and I help men and women stay youthful and vital no matter what their age. And I love what I do because I get people coming to see me for the first time who have all kinds of problems with aging, all kinds of issues, that they feel tired, that their brain doesn't work so well, that their mood is kind of down, that their overall vitality and muscle strength and libido are all fading away. And they come to me and they're hoping that I can do something that would be very helpful for them. And I must say that pretty much 98% of the time, we can really dramatically change how people feel within a period of 6 or 8 weeks. And the foundation of what I do is to work on natural hormones. For some reason, the human physiology is such that natural hormones fade away as you get older. We find that men and women, when they get to the age of 40, their hormones are definitely less than when they're 30. When they're 50, they are generally a lot less. For men, it's a very gradual slowing down. You see male athletes, they don't perform as well when they're 40 compared to 30. And when they're 50, they can't compete at any professional level. When women go through menopause, it's more dramatic. They can go through menopause at the age of 40 or the age of 50 or maybe until the age of 60. But whenever that happens, their hormones dramatically go down and they don't feel good. And they're not feeling good. It's not just limited to one thing. Some doctors think that, oh, if a woman is not having hot flashes, well, they don't need all these hormones. They're fine. No, they're not fine. They don't sleep good. Women lose a lot of sleep. They lose the ability to sleep soundly when they're not having hormone replacement. They think they're sleeping, but they just don't. They toss and turn, and it's difficult, and it's an easy fix. They don't need the prescription medicines that some doctors will give them, which is different sleeping pills and anti-anxiety pills and antidepressant pills. So many women who don't have a long history of depression will feel and act depressed when they lose these hormones, estrogen, progesterone, and testosterone. And they don't need prescription pills that work on moods. They need what they had in their body in natural hormones when they were younger. And then they feel better. Progesterone helps sleep and mood. Pregnant women have lots of progesterone when they're pregnant, then they feel happy. Estrogen helps the mind, the memory, as well as the bones, as well as the skin. And testosterone helps general brain energy, enthusiasm, vitality. Testosterone also helps muscle stamina, endurance, and it helps libido. It helps recovery from exercise. So when you give a woman these kind of hormones, they just feel a little young again. Men need mainly testosterone. And when they have testosterone, they feel like they can conquer the world again. They don't feel like they have to retire. They can exercise and enjoy their exercise and feel good, building muscle strength and endurance. I often tell my patients that my wife and I are ballroom dancers. We compete in amateur ballroom dancing, in standard waltz, tango, foxtrot, quick step, and it's real intense. when you're competing, it's very intense. And with these natural hormones, we can maintain that intensity and we enjoy it and it's fun. And you build up lots of muscle strength and endurance. And this extends your life. The research is very clear that you live longer with these kind of hormones. You live a better quality of life. You get less cancer and less heart disease than if you did nothing. And these are wonderful natural ways to replace what you've lost when you were younger. Now, there are some controversies in this area because the research shows that when you take synthetic hormones, you don't live as long. You don't live as healthy. You get more cancer and more heart disease. There's a lot of side effects from them. The drug companies make a lot of money from the synthetic hormones, but they are not as good as the natural hormones. The natural hormones are made by primarily compounding pharmacies who make natural hormones. There are some natural hormones, estrogen patches, progesterone capsules, natural capsules that are made by regular drug company pharmacies. And they're good and they have a value to them. Testosterone, they're not making that by big drug companies right at this point. But these synthetic hormones that are sold by big drug companies are not good for people to take. And the studies showed that. And many doctors read the studies in the early 2000s and concluded that, well, hormones are bad. Well, it depends upon if they're natural hormones or synthetic. It's important to take the natural hormones. That's what's going to make you healthier. And you want to go to a doctor who's going to give you the natural hormones because that's like night and day difference. So that's what I do primarily during my day. And the great mystery that we don't really know is why do men and women stop making the hormones that keep them youthful? We don't really know why. It's just part of what seems to be the aging process. And someday we'll have a way of figuring out how to keep your own glands active making these kind of hormones even though you're aging, but we don't have that ability yet. We have the pituitary gland, that's the master gland inside the brain that monitors all the hormones and regulates the levels of hormones. And one of the hormones the pituitary makes is called growth hormone. And growth hormone is called that because children make a lot of it as they're growing. But it's not really growth hormone. It's really a hormone of repair and rejuvenation. Young people rejuvenate their bodies very quickly if they get an injury. Old people, not so much. Growth hormone regulates all the other hormones. It's like the conductor of the orchestra of hormones and tells the other hormones how active to be. If you don't have growth hormone, all your hormones are told, oh, just take it easy, don't work at anything very much. Growth hormone helps all the other hormones be active. So it keeps your muscles strong, keeps your brain young, keeps your skin young. It helps repair and rejuvenation of all parts of your body. Growth hormone works very different than the other hormones. The other hormones work very quickly. You take testosterone, estrogen, progesterone, 6 weeks later, you feel great. Growth hormone is much slower acting because it's not directly working on anything. It's working on the other hormones. So it takes about 3 months to feel the benefits of growth hormone. We used to use growth hormone directly and gave you prescriptions for it where you would inject it into your belly fat. But Congress passed laws in around 1998 when the baseball players were hitting too many home runs and they broke all the records. And so Congress outlawed growth hormone for anti-aging purposes. You had to have a serious disease of your pituitary to take it. But now, in the last 10 years, we have releasing peptides, releasing factors, natural signaling that you inject into your body, into your belly fat, and it tells your pituitary, make more growth hormone. And usually do it while you're sleeping or just before you go to bed, because you make the growth hormone while you're sleeping. and you sleep deeper, and you dream more, and you rejuvenate your brain and your whole physiology, and you just feel younger. So these are some of the hormones. We have other hormones that we use, DHEA and pregnenolone, and there's many other hormones we can use to feel youthful. But I encourage everybody to have the part of your life where you're aging be the most productive part of your life. Don't feel like you have to retire and be old. No, you can be young and vibrant. What a great thing. And it's really easy, it's safe, it's effective, it's affordable. You're welcome to call my office and get more information about it. You're welcome to go to the website, ocwellness.com, and get more information about it. It is a lovely, lovely thing that I do. I love what I'm doing, and I wish that you all will take advantage of these possibilities to live vibrantly, live joyfully in a energetic, happy state where you can be creative. And so it's a pleasure talking to you about this, and I look forward to having you come in to see me if you can. Thanks so much.
Thank you for watching the Age Gracefully Show with Dr. Michael Grossman. Join us next week for another informative discussion to help you age gracefully. Be sure to visit us at ocwellness.com.